Well, hi, my name is Barb, and I'm from Iowa. And I was diagnosed back in November of last year, 2011, with a sarcoma of the left breast. And the biopsy that I had taken in Dubuque was actually sent to the Mayo Clinic up in Minnesota. And the final report came back as an undifferentiated sarcoma. They had difficulty even identifying it. All they could say is that it was very rare. It was very rare in the breast, and that it was an extremely aggressive cancer. I had thought that I just had another cyst. I had had a similar cyst 3 years ago and didn't think anything of it. My primary physician just thought it was another cyst. My surgeon thought it was another cyst, and then something must have looked a little odd to him, because then he did take that biopsy. So I was rather shocked when the diagnosis came back that I actually did have breast cancer, because it did not run in my family. We're not really sure where it came from. There's so many different places where cancer can start, and especially such a rare cancer. The doctors just really didn't have any idea where it came from. But I did have it. My husband and I have been interested in alternative medicine for many years, and for actually probably well over 20 years, we've been looking into different types of battling disease, using some alternative methods. And so I did, try some of these different methods. It looked like the cancer was being stopped. So right around the holidays, I was very happy. I actually had another biopsy done that said there was no cancer cells left in the tumor. However, after the holidays, I could tell that the tumor was starting to grow again, and unfortunately, had it tested and there was more cancer. The cancer there must have been some cells that were still left in the tumor and had started to multiply, and really this was a very aggressive cancer. It just grew. It was amazing how fast this thing grew. So we decided that using alternative methods just weren't going to be able to work with this type of cancer. And so I decided that I did need to have a mastectomy. So I had plans to meet with my surgeon in Dubuque, when a friend of ours down in Scottsdale, Arizona, called and said, well, there's this great protocol that Dr. Arnold Takimoto had come up with, had been working on for 40 years, and a naturopath in Scottsdale, Dr. Andrew Dickens, at Healing Pathways Clinic, was working with Dr. Takimoto on this protocol, and why didn't I learn more about it and maybe come down here and try it? And the essence of this protocol is to build up your body to help it to fight the cancer. And so their suggestion was to come down before the surgery and after the surgery. Well, just looking at this, it really wasn't going to make sense for me to have surgery and then to try to travel, and I wanted the surgery right away, so I really didn't want to come down here for several weeks and go through this protocol and then have the surgery. So what we ended up doing then was coming down here. I had a week of IVs of nanosilver and vitamin C. Nanosilver is to fight infections, and the vitamin C is to really build up your body and to fight cancer. And there's other minerals and vitamins also given, many supplements to help build the body up. And so I did about a week of these different therapies, found a wonderful surgeon down here in Arizona, in Chandler. He had a lot of experience with breast cancer, mastectomies, lumpectomies, so I felt very comfortable with him. So I had my surgery here. I think I'm doing a good job of healing. In fact, it was outpatient surgery. It took the surgery itself took like 45 minutes, and I went out to dinner with my husband and my sister after the surgery. So I thought that was pretty amazing. And then now I've been involved for the last couple of weeks with the follow-up with the therapies, which are the IVs, taking these products orally, taking many supplements, again trying to build the body up so that it can heal. I did have a PET scan this week, and found out there's a spot on my lungs. I did go to an oncologist to talk to her about different options, and she was not sure whether the spot was actually the sarcoma that had spread. The sarcomas like to spread to bone and to lungs, and so she was not sure if it was the cancer or if it was an infection. There also was a little bit of cancer activity along the edges of the incision. The tumor had been so large, the surgeon was not able to cut and to get clean edges. So, I was a little disappointed I didn't get a clean PET scan, but I was also glad it wasn't much, much worse considering how aggressive this cancer was. And I do credit this protocol for really helping me build up my body. Everybody I meet says, cannot believe I just went through surgery, that I had cancer, and that I've been undergoing this for months, since last November. And it's now the end of March. So I'm going to continue on with the protocol, with the IVs for at least another month, and continue on with the taking the vitamin C orally. And Dr. Dickens and Dr. Takimoto are very optimistic about my body being able to fight that last little bit of cancer or the infection in the lungs, whatever it is, and I'm very optimistic about it also. And I have to say I've had great support here from everybody at the clinic, and it's been, if you have to go through something like this, it's really nice to have such a supportive, comforting environment where you can go through this. One thing I should mention is that part of this whole life-changing journey has involved, it has really involved diet, not just supplements, not just IVs, not just taking different products, but actual diet. And that has been a very difficult thing. It's had some great benefits. I've actually lost a lot of weight, which I needed to lose. I had gotten into a lot of bad eating habits, and some of the things that I knew but sort of had ignored over the past few years have really hit home. For one thing, the body needs to be alkaline to fight cancer, so the type of water that you're drinking, the type of food that you're eating are all very important. Cancer loves sugar, so I am off sugar, which has been very, very difficult. The body wants raw foods, so I am eating basically salads, vegetables, very restricted amount of fruit, again having to be concerned about the amount of sugar. Also, part of this concern about food is to look for organic food, for food that is freshly grown, that is local, where you may know where it comes from. If you can grow it yourself, that's great. Luckily, my husband's a gardener, so he's putting in a big garden back in Iowa for me. For juicing, juicing is very important because you're getting a lot of nutrients then into your body very quickly. Doing without meat, most meats are very acidic, so basically you're going to be, I'm on a vegetarian diet, I'm off of gluten, I'm off of dairy. It is very restricted. Like I said, that's been very hard, but you're adding, when you're eating all these cheeses and breads, you're giving your body such a heavy load to digest, and you want your body to be fighting cancer, not digesting food. And so when I'm looking longingly at a piece of cake or at a nice big piece of fish or something, I'm thinking, no, my body has to fight cancer. It cannot be digesting food. So, I also realize that I am probably going to have to be on this very restricted diet for the rest of my life if I want to keep fighting cancer, because now that I've crossed this line into having cancer, it can always come back. Everybody has some cancer cells in their bodies, and something has triggered it in my body to have formed this tumor and to have spread. So I know I have to be careful now for the rest of my life, and I'm going to have to watch what I eat. But I strongly advocate to people, start watching what you're eating now so that you don't have to go through a mastectomy or any other kind of surgery for cancer.
Well, here we go. This is Barb's last day. We're cleaning some things up. We have her on electrodermal screening to see where she was at. Was vastly improved from when she came in a month's time. I don't know if you can pull this up, but she had greatly improved. So for example, the fatty degeneration, we weren't even able to get a reading on that a month ago, and now we've got a reasonable reading. It's not great, but it's reasonable. So we've been making great progress. This is Barbara's last IV of nanosilver, which we're working on killing off microbial organisms of any form, whether that's bacterial, fungal, viral. We're finishing that off, and we've been testing her acupuncture meridians to see where she was at, and so we've added a few things. We've cleaning up her gut a little bit and fine adjusting a few other things. So we're getting ready to send her off. She leaves on Saturday morning.
Yeah, tomorrow.
Yeah, tomorrow. So that's
I'm leaving the nest.
Yeah, we're kicking our baby eaglet out of the nest tomorrow morning. So she's been here a month. We've been running a month oral and IV protocol, and we're sending off everything for her to do another month of the IV protocol. So she will be arranging for a home care nurse to come by and give her IVs back at her home in Iowa.
Yes.
So what do you think of all of this?
Well, it's been quite an experience. It's been life-changing. It's been very, very hopeful. This is a very supportive environment, and Dr. Dickens is very supportive, very kind, very easygoing, and very knowledgeable. And I know when I'm somewhere and yelling, "Dr. Dickens, come look at this," he's right there to explain to me what's going on and check it out. And I really have appreciated that support. And it's kind of scary leaving the nest when I know I could just yell, "Dr. Dickens," and I'm going to have some great help and support there. So I'm going to miss this place and the wonderful people that work here and come through here and the patients. It's a very positive experience.